Hello there, I'm Shubhanjan from Physilife, and this video is about a pen. A pen that you should use while applying dry needling. I see many physiotherapists using different pens while marking for dry needling. So I thought why not make a video and say the pros and cons and the kind of pen that I recommend. First of all, you could ask the question that why should we use a pen while performing dry needling, because in most of our other modalities we don't use a pen. When you apply say ultrasound on your patient, you don't really need to mark the area. The patient says pain is in the front of the shoulder and we apply the ultrasound in the front of the shoulder. However, dry needling is very focused. Say my deltoid needs to be needled. So with dry needle you have to pinpoint the area, literally pinpoint the area where you need to go in. So if the pain is here and I start to needle here, then it's a problem. And that's why you need to apply a pen mark so that you can go to the correct area. That is one reason. The other thing happens is when the patient comes, I assess, I find, I palpate the point of maximum tenderness where I want to go, and then I probably go and prepare my hands and prepare my treatment tray, come back and I'll have to press it again, and I need to find which area the patient is having pain. So the patient goes through double the amount of palpation pain. The third thing, many times we may need to mark the surface anatomy to avoid the important structures that I don't want to go to while performing needling. So these are reasons why many physiotherapists, while applying dry needling, a lot of time they use a pen. Now the mistake that we make is we end up using a normal pen, a writing pen that writes on paper. And the problem with this pen is this is not sterile at all. The tip is open or closed, the environmental germs will go in, and unless the ink is sterile and the tip is sterile, you should not use it, because we may inoculate the germs, bacteria, viruses, etc. inside the patient's body. Then I see many people using a whiteboard marker. And the logic behind this goes as the whiteboard marker has a spirit in it, and I agree, the ink has spirit and the ink is readily removable, so it could serve the purpose. The problem is, again, this is not for the specific purposes. So I imagine I have made a dot and you insert a needle inside. What is going to happen? The ink, which is spirit plus some soluble ink, goes inside. And who knows, there would be some germs, virus, bacteria which can go in. People would say this is far-fetched, but consider this funny scenario that you or one of your near ones is going for surgery, and you ask the doctor that doctor, when you mark my dear one's body, why don't you use a whiteboard marker? And see what reply that the doctor gives. So this is also, in my opinion, ineligible. But then people will say that both of these pens are being used, and none of our patients so far have shown any infection. Why is that so? That is because all of our patients are having normal, natural body immunity. But then, and that is why what is happening is the patients are going to overcome even if we inoculate a germ. But then, do you want to take that risk? Do you want to challenge the immunity in such a way? There could be a patient, and I don't know who will that person be, who whose immunity will fail. Theoretically, many things can happen which may compromise the immunity of the person locally in that area, and then we kind of end up giving the patient some sort of infection. So what is the remedy? The remedy is a surgical skin marker. You can get either this or many other sort of surgical skin marker in your surgical shops, in Amazon, Flipkart, and I recommend using them because the ink in this is, if you can see, it's essentially a gentian violet. The gentian violet is the antiseptic that the government hospitals use And because this particular pen is having a sterile ink, it is much more safe and the recommended procedure to use on your patients. What if you don't get access to a surgical skin marker? The second best options will be to get those mercurochrome, the red paint, or the gentian violet, the violet paints that you can get in any medicine shop for cheap, and those will come in a small, say, dropper kind of thing, and put a cotton bud and put a drop of that on the patient's body where you want to mark. So next time when you needle, please use a good surgical marker, because we want to do the best that we can for our patients. In all my dry needling workshops, along with the other stuff in the dry needling kit, I also provide all my participants a surgical marker. When they start with correct practice, they tend to maintain the correct practice. I hope from now onwards you'll also shift to a surgical marker. Thank you.